Regarding the 4 patients admitted, patient 121 is a 78-year-old female, no known allergies with hypertension, type 2 diabetes mellitus, coronary artery disease, and chronic kidney disease stage 3. Patient lives alone in a small apartment in a senior assisted living facility and was found confused and disheveled by the facility staff. EMS transferred her to the hospital for medical evaluation. Patient is widowed, living independently at a senior assisted living facility. She has 3 grown children living out of state who remained in contact with their mother. S1, S2, S3 present, irregular rhythm noted, lung sounds clear to auscultation with diminished sounds at base bilaterally. Patient is drowsy, confused, and oriented times 1. Vital signs are as follows: temperature of 97.8, pulse of 110, blood pressure of 92/50, respiratory rate of 28, and SpO2 of 93 on 4 liters O2 nasal cannula. Preparing to administer medications as prescribed and awaiting further orders. Patient 120 is a 55-year-old male, no known allergies, admitted to ED yesterday, presenting with confusion and agitation related to alcohol withdrawal. Patient coded in ED, intubated, and transferred to the medical ICU, unable to obtain full, accurate history of review of systems from the patient. Patient is divorced and estranged from his 2 adult children. Patient works in construction until laid off 3 weeks ago. Patient smokes 1 pack of cigarettes per day for 30 years. Drinks 6-pack of beer daily for the past 20 years. Recently began binging on vodka since job loss. Patient has had 4 prior hospitalizations for ETOH withdrawal with detoxification and documented history for previous seizures related to ETOH withdrawal. Patient currently sedated, S1, S2 present, normal rhythm, lung sounds clear to auscultation. Patient on ventilator with settings as follows: ventilator rate 12 volume, 550 milliliters per minute, PEEP at 5, FiO2 40%, and PSV at 10. Preparing to administer medications as prescribed and awaiting further orders. Patient 138 is a 68-year-old female, no known allergies, admitted with complaint of abdominal pain, left upper quadrant mass with unintentional 20-pound weight loss in 2 months, fatigue, shortness of breath, anorexia, nausea, and vomiting. She just received diagnosis of stage 4 pancreatic cancer with metastasis to gallbladder, duodenum, and liver. Patient has prior history of pancreatitis, tobacco use of 1 pack per day for the past 35 years. Patient lives with boyfriend, works in casino, and denies drinking. Patient is alert-oriented times 3, normal sinus rhythm with S1 and S2 present. Right lower lobe crackles noted at base. Other lobes clear to auscultation. Abdomen is painful to palpation to the right upper quadrant. Patient is guarding. Hepatomegaly. Liver edges 2 centimeters below the rib. Abdominal pain radiates to back. Gallbladder is palpable with epigastric tenderness. Dullness to percussion right abdominal quadrant. Preparing to administer medications as prescribed and awaiting further orders. Patient 132 is a 68-year-old male, no known allergies, who appears to be of stated age and admitted for complaints of flank discomfort and intermittent nausea. Patient has past medical history of hypertension, benign prostatic hypertrophy, chronic urinary tract infections. Patient had internal fixation right femur 20 years ago. Patient is alert and oriented times 3, S1 and S2 present. Lung sounds clear to auscultation. Vital signs are as follows: 120/80 for blood pressure, pulse 70, respiratory rate 12, and SpO2 98%, temperature 99.4. Preparing to administer medications as prescribed and awaiting further orders.